Hi, can I help you?
Hi, yeah, I'm here to pick up an antibiotic prescription my doctor sent over.
Sure. What's your name and your date of birth?
It's Janice Doe, that's DOE, and it's 12/6/92.
Okay, let me take a look at our system.
Sure.
So looking at our records, I see this is the first time you've had a prescription for us. Do you mind if I get some additional information for health screening?
No, that's fine.
This is something we do for all the patients at our pharmacy.
Okay.
Okay. One more time, what's your date of birth?
It's December 6th, 1992.
Okay. And your address?
It's 731 North Pond Street.
Okay. Do you have any allergies to medications?
Nope.
Do you have any chronic health problems? Have you ever been in the hospital, ever had surgery?
No, pretty healthy.
Okay. Do you take any prescription medication?
I do, yeah, orthocycline.
Okay. Do you use any over-the-counter medications, herbals, supplements?
Yeah, I'll take ibuprofen occasionally for headaches.
Okay. There. Do you use tobacco at all?
I do not.
Okay. Do you use any drugs for non-medical reasons?
Nope.
Okay. Do you drink alcohol?
I do, yeah.
In the course of a week, how much do you estimate you drink?
Oh, maybe around, I don't know, 12 to 15 or so drinks.
Okay. And kind of what's your pattern with that? Like, do you drink more on the weekend? Is it kind of spread out throughout the week?
It's pretty spread out. I mean, part of my job is entertaining clients, so we'll have a couple of drinks at a dinner or a bar. On weekends, I'll go out with friends.
Okay. Okay. I appreciate you answering these questions. Do you mind if we talk a little bit more about your alcohol use?
Sure, if you think it's necessary.
Okay. So I have two concerns today. One of them is more of a short-term concern, and the other one is more of a long-term concern.
Okay.
With your new antibiotic, metronidazole, when that is combined with alcohol, it's a pretty serious drug interaction, and you can end up developing some really serious nausea and vomiting, which could be uncomfortable. So anytime that anyone uses metronidazole, it's really important to stop drinking for the week, including things that might have like hidden sources of alcohol, so like cough medicine or mouthwash, because we worry about the risk of nausea and vomiting.
All right, that's interesting.
The second one is thinking about kind of some of the long-term health consequences of drinking. So looking at this chart, the reason why they have these limits is, again, thinking about kind of some long-term consequences, so being at increased risk for things like cancer, liver disease, nutritional deficiencies, heart problems. So things that can be really pretty serious on there.
Yeah.
You look really surprised by this information.
Yeah, I mean, I never thought that, it's not like I get drunk. I don't ever get drunk. And it's part of my job to go out and entertain, and I've never missed any appointments. It's not like it's ever been a problem, and my doctor has never mentioned anything, so it's sort of interesting to see this.
Have you ever found that you've needed a drink in the morning to kind of get you going, or ever had any, difficulty sleeping, kind of any tremors, feeling anxious if you weren't drinking?
No?
Okay. So there's a couple different options we can do. So for your antibiotic, the first option is to not have any alcohol for the week while you're on the antibiotic. The second option is I can give your doctor a call and see if they're willing to switch it to another antibiotic.
I think in terms of practicality, I need to go out of town tomorrow, and I wasn't really expecting this, so I think it would probably be best to try to get something else that wouldn't have the same interaction.
Okay.
If that's possible.
Okay. Before I give them a call, though, I just have a couple other questions for you.
Sure.
So thinking about kind of the long-term picture and the things we talked about, on a scale of 0 to 10, with 0 being I'm not ready to make any changes, and 10 being I'm very ready to start making changes today, where do you see yourself on kind of that 0 to 10 scale?
I would say probably a 3 today.
Okay. And why did you pick a 3 instead of picking, say, like a 2?
Well, I'm not completely unwilling. I'll consider it, and if it's something that can work out in the future, I could, maybe move that number up. But in terms of my job right now, I don't see it being a huge possibility at the moment.
Okay.
But maybe in the future it's something that I could think about.
Okay. Do you mind the next time you come in the pharmacy if we talk about this again?
Yeah, if I have time, sure.
Okay. I'm going to give your doctor a quick call and see what we can do about getting that switched.
Okay, thanks.
Thank you.
Sure.